Well, the Atlanta-based Centers for Disease Control and Prevention says an American doctor in Africa has tested positive for Ebola. This outbreak is centered in the Democratic Republic of Congo and Uganda. The agency says it has sent teams and supplies to help track cases and expand testing. Authorities believe the Ebola outbreak has caused more than 130 deaths so far. And with these infectious viruses making headlines, how prepared is the U.S. for a major outbreak like we saw with COVID-19?
I think we all probably want an answer to that question,
absolutely.
right? Brian Abel is talking with experts to get a sense of America's readiness.
An alarming confluence of outbreaks across the globe is raising fears of a future pandemic like COVID-19. Hantavirus, Ebola, and measles, among other infectious diseases, are making headlines in the U.S. and raising questions over preparedness.
The measles outbreaks that are littering the entire country are a direct result of the fact that our public health preparedness, our respect for infectious disease, our respect for vaccines has completely eroded.
Experts say U.S. administrative changes since COVID, along with a slip of trust in public health institutions, are having an impact.
Prior to the Trump administration, USAID was there, CDC was much more robust. Those tools are much weaker now. USAID is completely gone.
President Donald Trump's withdrawal of the U.S. from the World Health Organization has constrained the ability of the CDC to communicate with it.
The CDC is not necessarily always at the table at the earliest possible juncture when there is an emergency.
Some public health experts worry these changes, along with deep cuts to the CDC, will make it harder for the U.S. to respond now and in the future.
The infrastructure cannot be built overnight. How much infrastructure is already there and how much has been decimated as a result of recent cuts, I think we'll only find out if we have trouble containing this outbreak, which of course is too late.
But there is some good news. Dr. Imish Adalja says there have been some key improvements in recent years.
When it comes to technology, innovation in science and medicine and tools, we are much more advanced now in 2026 than we were in 2020.
In Washington, Brian Abel reporting.